So, good day everyone. My name is Trishan G. Martinico from BSN 2D, and today I will be administering intradermal medications. So, the materials needed are the medication administration record or the electronic medication ticket pen, the appropriate size of the syringe and needle for type of injection on viscosity of the solution, the disposable gloves, which is optional, the alcohol swabs, medication to be administered, 1 ml syringe with 26 to 28 gauge needle, and then medication tray. So the first procedure is to do or perform the hand hygiene to prevent the transmission of the microorganisms. The next is to prepare the drug to be administered according to the 5 rights of drug administration. It is the right medication drug for the client. Next is to identify the client by checking the identification bracelet and by addressing the client by its name to have the right medication to be given. The next is to explain the procedure and the purpose of the medication to the client for the cooperation of the patient. The next is to verify the allergies that is listed on medication record or electronic medication record to avoid medications that would harm the patient's health. So the next is the Dawn glove. So to avoid the contamination of the medications. Select the injection site on forearm if no other site required by the agency policy or the doctor's orders. Use alternative sites if forearm cannot be used. Select that the easier and accessible where the proper route is ordered. Position the client with forearm facing up. Easy and accessible placing the injection. Cleanse the site with alcohol using a circular motion starting from the center and working outward. Allow alcohol to dry. The rationale for this is no microorganisms or cleanses away bacteria and prepared for the injection. The next is to remove the needle cap to prepare for the injection. Place the non-dominant thumb about 1 inch below the insertion site and pull the skin down hand. It prevents excessive bleedings or irritations. The next is talk to the client and warm on impending needle stick to make the patient to be aware on what to do. Next is to, with the bevel up and using the dominant hand, insert the needle for just below the skin at 10 to 15 degree angle. The right insertion of the needle for accurate result of the procedure. The next is once entry into the skin surface is made, advance the needle another 1/8 inch for the needle to be secure and inserted to the dermal accurately. Inject the drug slowly and smoothly while observing for blood or a raised welt to form. The blood should be present. Slowly but surely, less pain and to observe. Remove at the same angle that it was inserted for the less pain and to prevent from blood. Next is gently remove the blood, if any, by doubling with second alcohol swab. Make sure when removing any fluid in skin, make sure you are using a clean swabs. Observe for skin redness or swelling. If this is an allergy test, observe for systematic reaction, respiratory difficulty, sweating, faintness, decreased blood pressure, nausea, vomiting, and cyanosis. Report immediately to the doctor what procedure should be done. Recess the client an injection site after 5 minutes. After 15 minutes, then periodically while the client remains in the clinic. So if there are any allergic reactions or any fluid spilling. Next is to place and cap the needle on the tray. Remove the gloves to avoid injury and or accidents for safety. Next is to mark with blue or black pen around the bleb and to instruct the client not to rub the area. Highlight the important ones differently to make it precise and clear. Reposition the client for patient's comfort. Next is to discard the equipment appropriately, removing the equipment that is not needed. Perform hand hygiene to prevent the transmission of the microorganisms, and then document administration on the medication record for accurate administration. Next, so the attitude of the student nurse should be, they should accept the constructive suggestions or criticisms. You should be open to all suggestions and criticisms from errors, and then assumes accountability for the improvement of oneself or the betterment of the oneself. That would be all. Thank you.